Zorba, you're big, but not Tom Hanks.
I'm no Tom
Speaking of
Hanks.
star power, back on the couch.
Back on the couch. Let's go to the phones. We'll start with Kathy in DeForest. Hi, Kathy. What's your question?
I'm currently taking gabapentin for shingles, and I would like to know if there is an over-the-counter homeopathic method that I could try instead of what I'm on, and how would I wean myself off of it?
Oh, sure. First of all, gabapentin is really a good drug. It's a really good drug for shingles, for chronic pain, certain types of chronic neuropathic pain. There's no equivalent that's over the counter, but you certainly can try something. If you're looking over the counter, you can do diclofenac gel. That's a gel that we put on top that basically is an anti-inflammatory. You can see if that works. From a point of view of homeopathic remedies, not my bailiwick, not my tool chest, I would recommend you talk to someone else about that.
And get a shingle shot.
And, of course, get a shingle shot. When you're better, get that shingle shot because that's basically going to keep you from getting it again. You can get shingles once, twice, 3 times. You want
Don't tell me I had it once. I don't want
It's enough. One and done.
Yeah.
All right. Well, up next, Steve from Madison. What's your question?
Hi, Dr. Paster. I wanted to ask Dr. Paster if he's heard of an organization called Recovery International. It used to be called Recovery Inc., and it's based in Chicago, and it's all over the world, and it helps me deal with nervous symptoms and fears.
Sure. No, I don't actually know of that organization. There are lots of good organizations, and the real issue is you want to make sure that's one that's good, that's not fake, and that's where you often have to go and look at other people and ask other people what they're doing. I always question whether or not they want to have your credit card in order to get that, because there's so many things that are really scammy that are on there.
Yeah, that is a warning sign. All right, Carol in Marshall. Hi, Carol. What's your question?
I am looking at bone-on-bone need of shoulder replacement. But is there a way to regrow the cartilage so I don't have to go under the knife for shoulder replacement?
You bet. I wish there were a way. There's some things that are really important that are experimental right now, but there's nothing that's proven that actually rebuilds cartilage. And basically, as soon as that's done, believe me, invest in that company because they are going to make a ton of money.
And from McFarland, we have Dan. Hey, Dan, what's your question?
Hi, Dr. Zorba. I've got kind of a itchy scalp all the time, and I've tried a doctor's prescription, but it didn't seem to really do anything. I was wondering if there's anything else you'd recommend for just itchy skin and scalp?
Sure. There are a lot of things you can use for an itchy scalp. Over the counter, Selsun Blue is great.
Really?
Put it, yeah, absolutely great stuff. Put it on the scalp. Put a one of those plastic hats on top of it because it's got to be there for about 5 minutes. So you wash it off. So you put it on your scalp, soap yourself up, put it on the scalp, put a little plastic thing on there, leave it on for 5 minutes, and then wash it off. Do that 2 to 4 times a week. That can really make a difference.
Does it come with the bag or?
No, you've got to get it. You've got one of those shower caps that look ugly.
Sure.
One of those ugly shower caps.
The uglier, the better.
Just stay home. Don't go outside. All right. Dottie in Madison. Hi, Dottie. What's your question?
Hi. I was watching a program just before this that said Delta Airlines was going to sue the government about guidelines for coronavirus. You're Dr. Zorba Paster. We've been told to follow our own personal health initiative. And I just comfortable with metrics and the science, and I'd just like to know as a doctor, what are you doing? What are you going to do about this?
Well, first of all, when I go on an airplane, and I've been traveling quite a bit in the airport, it's the requirement to wear a mask. I'm going to wear a mask. And when I go in an airport and I'm going through next to all those people standing in line, I'm going to wear a mask. So I don't think you really should just follow your own guidelines. I think you have to look at the science behind it, what the CDC says, and follow that information.
Any transportation right now, you still need to wear a mask.
Absolutely. That's the way it is. And you know what? Hey, safe is better than not safe.
And if you don't want to wear a mask, don't get on a plane.
That's right. Your choice.
All right, Zorba, good to see you again.
Good to see you in person. In person.
Live and in color. Thank you all for calling in. We'll do this again next week, and we'll have a final check of your forecast coming up.